Guys, what's going on? This is Dave Tilley up at Champion Physical Therapy in Boston. I'm here with Dan Pope, and I want to show you guys more of the medical side of assessing internal rotation for bar path and keeping good alignment of the bar from the bottom through up straight here. So a lot of times I think we find athletes who do lack internal rotation, and unfortunately the assessments that are given for their shoulder soft tissue mobility don't always accurately show pure glenohumeral rhythm versus maybe scap tilting. Right, so what we want to do is we want to make sure that we're assessing pure glenohumeral internal rotation and not getting any compensation. So what we're going to do is I'll show you. A lot of times what we'll see is people will come here and they will, totally relax in and they'll show it, and maybe they don't get good, pure motion from the shoulder. They're like, wow, this internal rotation looks pretty good. But you can see on Dan what here is happening is he's running out of room and he's elevating off the table, which means he's probably getting some anterior tilt, right, and some internal rotation of his scap as he lacks maybe soft tissue mobility in the back. So what you want to make sure you do is with your thumb, right over the coracoid is stabilizing here and getting in the back of your shoulder, and then using that to see what their true internal rotation is. Now, Dan, I'm kind of fibbing it here, but he does have good internal rotation, but this is what we commonly see is someone who's really limited. Now look at where the bar is going to be in relation to his chest, right? That thing's going to jump in front of him, or he's going to hop to get it for that, or it's going to loop around the back because he can't keep it straight up in his face. So you have to make sure the athlete is here, and what you want to see is someone who has, like Dan does, very good true internal rotation. The bar is now going to be much more vertical to his chest. So what we do for this commonly, right, if someone's having stiffness in the back of their shoulder, one of our favorite things to do is coming underneath the scap, right, pinning down some of this soft tissue here and holding his scap in place while I do that. And Dan, let me just have you go across your body 3 or 4 times. Right, and I can kind of guide him with it, but I'm holding his shoulder blade in place and I'm also pinning down that tissue that I'm trying to get at. And then maybe at the end range here, right here, Dan, push into me gently, maybe 10%, relax, push in, relax, right, some contract, relax at end range, all to affect the soft tissue mobility here that might be stiff from maybe touch and go volume of eccentric overload, other soft tissue approximation issues from pulling the bar too much with technical faults. But just a couple quick tips there to make sure that you're accurately assessing internal rotation and then you're dealing with it the right way.